Hello, my name is Asia. I work at Central Outreach Wellness Center. I'm a medical assistant technician. I will be showing you today how to self-administer your own hormone injection. Okay, so there are a few things that you're going to need before getting started. You're going to need a draw needle. You're going to need an administration needle. You're going to need your medicine, your hormones specifically, an alcohol pad, 2 for sure, and a Band-Aid for those who need them. Okay, so since you're at home, you probably won't have gloves, so I won't be putting those on today. It's probably just like you guys. When you're doing this, the reason why you have 2 needles is because you want to pretend that there's always bacteria in everything that you're doing. So since this is an aseptic technique, you want to make sure that you have 2 different syringes. So the one that you put on after you draw your medicine will be sterile. It will be sterile. There won't be any bacteria on it or anything, and that's the whole point because you're sticking it inside of your body. So I'm just going to show you guys how you want to draw, and you want to get your medicine in there and stuff. It's actually very easy. Take off the cap if it's brand new. And even if this is new or old, you still want to use an alcohol pad to wipe it off, because once again, we're going to pretend that everything is covered in bacteria. So a few wipes and that's done. Okay, so you want to get your syringe. This is going to be the draw needle. This is where you're going to use this to get the medicine into the syringe. So I use 20, this is the 20 gauge. I like 20 to 18. Smaller the number, the wider the lumen. So since this is a thick medicine, that's good. You want to be able to get it in there fast. So I take 0.6 mLs. So I'm going to pull it down to where I'm going to draw it at. And this is going to help with the pressure so that you can actually get the medicine in there. So, one swift move. And you want to make sure that you are putting the syringe and the vial to your face to eye level so that when you're measuring, you're getting the exact number. Now I put it to the next line after my 0.6 because when you are getting the air bubbles out, I am depending on that to even it out. So I'm gonna just switch the needles real fast. So we're gonna go from that 20 gauge to a 23. And it's pretty simple. Twist on, twist off, lefty loosey, righty tighty. And then you're gonna just fill that air pocket. You're gonna let those bubbles out. Just enough. Perfect. So you see one drop of medicine, and you know that the airway is most likely clear and you're gonna be fine. But don't be scared because a bubble or 2 in here is not gonna do anything. Your body can naturally handle gas, okay, and air and all that stuff. So next we're gonna do is the actual injection. All right, so now that I've chosen my site and I have my alcohol pad, I am going to cleanse it. I'm going to be placing the alcohol pad where I imagine I'm going to stick myself at. So right here, and I do circular motions outward, like that. That was very easy, probably the easiest part. All right, so I'm gonna loosen the top of this a little bit, like that, and wait for the alcohol to dry, because if you don't, it will sting when you inject yourself the entire time. Okay, so I'm going to grip my thigh very tightly. I'm going to make sure that my bevel is good, that there are no obstructions or any type of metal abrasions hanging out, because if you stick that into your leg, it's going to hurt. I squeeze very tight. I call this counter pressure, so you don't feel anything. And here we go. Now you aspirate first. And you see those air bubbles? That means that I'm not in a vessel, so I'm okay to go along with the injection. And this is thick, so it might take a second. There you go. And you're gonna put your syringe and stuff inside of your sharps container. If you don't have a sharps container, you can use an old apple juice bottle, big Gatorade bottles. They're very thick plastic where you can put a top on and just dispose of it. Now I use where's my Band-Aid? I use my Band-Aid after that, and I usually massage it in for about 30 seconds just to help with the breakdown. And the reason that hormones are done intramuscularly is because Like when your body regularly emits hormones from, say, the pituitary gland, it happens over time. So you do it in your muscle, you're gonna get a lump, you're going to get maybe some bruising. This is all natural because the medicine is sitting and taking its time to go through your bloodstream. So that's the point of aspiration when you're putting it in, because if there is blood, you won't die from putting it in your blood vessel, but you will be now administering it the wrong way. So you will literally probably get what should be 2 weeks worth of a shot, probably one day. Like probably literally, you just injected water. So there we go, I'm all done, I'm good.